It is day 4 of Women's Health Week. Today, we're taking a bit of a class, Advanced Gynecology 101. We're joined by Dr. Michelle Passes from Christiana Care's Center for Advanced GYN and Minimally Invasive Surgery, and Dr. Emily Sachs from Christiana Care's Center for Urogynecology and Pelvic Surgery. Thank you both so much for being here today. Please take a minute to introduce yourselves.
Well, thanks for having us today. My name is Emily Sachs. I have been at Christiana for almost 12 years, practicing in the Center for Urogynecology. I'm a pelvic surgeon specializing in urologic and gynecologic conditions of the pelvic floor.
And thank you so much, Megan, for having me as well. I'm Michelle Passes. I am a minimally invasive gynecologic surgeon here at Christiana. I've been here for 3 years, but I've also practiced in New York as well. And I'm also the Associate Program Director for the Fellowship in Minimally Invasive GYN Surgery.
That's great. Obviously, you have so much information that you're going to share with us today, but if you're watching at home and have specific questions or things that you're particularly interested in, please submit those questions in the comments below on this Facebook Live, and we will get to those questions throughout this conversation. So the issues that women come to your practices for are often issues that many people don't talk about. So why is it so important that we're having this conversation today?
So Megan, it's incredibly important. We take care of many women with urinary incontinence and pelvic organ prolapse, and I know we'll get to discussing those conditions in a little more detail as the talk goes on. But in general, these are really under-discussed, underdiagnosed, and undertreated conditions that are actually incredibly common for women. They are much more common as we age, but they're certainly not a normal part of aging, as many women sort of brush these conditions off and feel that it's inevitable as they age to develop some of these conditions. And so really important to be able to reach out so that patients are aware that these are treatable conditions and that we really have a very wide variety of treatments to offer women with these conditions.
Absolutely.
And I really appreciate this question. I think that it's really important for us as healthcare professionals to really demystify and destigmatize women's bodies and women's health. I think we can do this through educating women in our community about women's health issues that may not just be making them sick, but also that are decreasing their quality of life as well. I think we often, as Dr. Sachs mentioned, we sort of brush these things off and we normalize, let's say, periods, for instance, just because women in our family are kind of going through the same, they've all had heavy periods, or moms or grandmothers or aunts. They're prolonged, they're painful. And we seem to think that that's just what we need to deal with as women, and that's simply not true. There are definitely ways that we can make that better and improve quality of life. I think it's important to increase awareness for patients and also providers about some traditional and maybe newer and medical and social or surgical therapies. And, even if you're having normal periods and you don't want them, we could do that for you as well. It's we're taught to think that periods are, totally normal and okay, and that we have to have a cleansing every month, but we actually don't have to. So these are some things that we can empower women with to make their lives a little bit better.
There's so much that we can talk about, but some may be watching and have a little bit of a better understanding about the differences between your two specialties, but let's flesh that out a little more. So Dr. Sachs, I'll start with you. What do you specifically treat in your practice?
So we do not treat sort of routine gynecology or routine gynecologic conditions. We really are focused and specialize on the pelvic floor. In fact, sometimes I like to describe our practice as a Venn diagram between urology and gynecology, because we really are focused on some really specialized conditions. Two of the most common conditions we treat are urinary incontinence, so leakage of urine that is unintentional for whatever reason, as well as pelvic organ prolapse, which is essentially the dropping of pelvic organs. If you've heard of somebody who says, my mom's bladder dropped or my uterus is dropping, this is what we're referring to. Urinary incontinence comes in several different varieties, and many women may experience more than one. Most commonly are conditions called stress incontinence and urge incontinence. Stress incontinence is leaking with coughing, sneezing, exercise, or other movements that impact the pelvic floor. Whereas urge incontinence more refers to leakage of urine associated with a really sudden and compelling urge to urinate that's difficult to defer. And so those are two of the biggest things we treat. The other main focus, as I mentioned, is pelvic organ prolapse. And again, this is a condition that is a result of a lot of genetics, as well as pregnancies and deliveries. It's really multifactorial, and it's just really common. Both conditions really can have a significant impact on women's quality of life. And so really important that we're able to kind of focus on these really important and common conditions to help women. We also care for some other conditions that may not be as common, such as fecal incontinence or unintended leakage of the bowels, as well as some other urologic conditions, things like fistulas, which would be an abnormal communication between some of the pelvic floor organs, and some other issues in terms of pain or infections related specifically to the pelvic floor.
That's very specific, and I'm sure something that a lot of women are thankful that you specialize in. Dr. Passis, what about you?
So I think that sometimes the urogynecology world and the MIGS world will overlap in some of the conditions that we see and treat. A majority of our referrals are for the medical and surgical management of abnormal uterine bleeding. And this can be caused by any number of things, by fibroids, which we see commonly. We actually have a fibroid center. Adenomyosis, which I always refer to as a cousin of endometriosis. And sometimes other people are being treated for other medical conditions, let's say with blood thinners, and that might impact their bleeding as well. And so there are many things that contribute to bleeding, both premenopausal, but we also help women who are bleeding in the menopause, which is abnormal and not a lot of people know about. We also treat patients who have pelvic pain, particularly as it is associated with a condition called endometriosis. And I mentioned its cousin before, adenomyosis. But endometriosis is when you have the lining of the uterus and that tissue is where it shouldn't be, and it can cause painful periods. Adenomyosis can, of course, cause heavy bleeding as well. So when we treat these conditions, and we also can treat conditions such as these that are also related to infertility. However, as Dr. Sachs mentioned, we also treat other things, one of which is perhaps ovarian cysts. So there's many other things that we treat, but I think the most common are bleeding, fibroids, pelvic pain, and endometriosis.
So we talked about conditions. Let's transition into treatments. Dr. Sachs, what is a typical treatment like for urinary incontinence?
Sure. So really a wide range of treatments are available for women. Again, it depends on what type of incontinence is predominant and or the patient's, obviously the patient's goals and treatment. I just want to stress also that urinary incontinence is really a continuum, and being diagnosed as a disorder really is dependent upon patient's perception. So we have patients that may only leak with a very vigorous exercise class. We have patients that may leak all day long with every cough, sneeze, or movement they make. And so again, no amount of incontinence is too small to get treatment, and certainly no amount is too large. In terms of treatment options, I would say, again, because this is an incredibly important condition in terms of the impact on quality of life. However, these are not conditions that are medically dangerous to patients. And so treatment is offered if patients want to be treated. And so there are some women who may not want treatment, and that is okay. That is an option for sure. But for women who do want treatment, we're able to kind of come up with a treatment plan together that most suits her needs. Treatments really can range from very conservative treatments, such as behavioral changes, strengthening the pelvic floor, retraining the bladder. And we do that in a variety of ways, sometimes working in conjunction with pelvic floor physical therapists who are specialized physical therapists who have additional training to treat the pelvic floor. We can also treat incontinence with a variety of medications, some surgery, as well as some other procedure-based interventions. I'm happy to talk about any more of those if people have questions.
So let's go to Dr. Pasas first. So quality of life, Dr. Sachs mentioned, I know that that's something certainly both of you have in common, is helping women get that quality of life that they're looking for. So talk about your treatments for endometriosis and its terrible cousin and those things that, women are really struggling with.
Yeah, so, I think that the most important thing is to realize how many people are actually impacted by endometriosis. Approximately 10% of women have endometriosis, and that's based on the literature that we have, but I actually do think it's quite underdiagnosed, and perhaps many more people than that 10% have endometriosis and are living with it. And unfortunately, it takes about 10 years for women to come to care and actually have a diagnosis. Half of women, up to half of women who have infertility also have endometriosis. So it really impacts a woman's ability to expand her family when she chooses to. I'm happy to say that over the years, there has been an increase in awareness about endometriosis just from the blowing up of social media. So I think it's been really a great way to spread this information to women about these chronic pain conditions. In recent years, there has been an involvement of medications and surgical technologies to improve patient outcomes. In the past, and we still do use them, hormonal suppression, anti-inflammatory medications, these have always been known to be the mainstays of treatment for endometriosis. But I think that there have been other medications that have come on the market that have less impact on side effects, namely impact on bone and also menopausal symptoms for these medications, which could be quite harsh. You're trying to improve quality of life, but in the same respect, sometimes medications will take away quality of life. So it's nice to have some options that might mitigate those things. And we know that surgical technology has really improved over the years. In the past, many women had to have these big open surgeries, quite morbid surgeries. We're able to perform these surgeries with minimally invasive approaches, laparoscopy, robotics. So our center really has taken both of these technologies and uses them quite frequently. And these improve patient outcomes. I think the other thing to note is that we've also realized that treating endometriosis and adenomyosis is really oftentimes a multimodal or multidisciplinary approach to care. So it's not just, the one pill fits all type of modality of treatments that we used to have before. We actually are now realizing that there's a pelvic floor component. So we often employ pelvic floor physical therapy, where we also address nerve dysfunction, which is commonly associated with this disease process. And then we also involve, for surgical interventions, we involve other surgical subspecialists. Those can include urogynecologists, urologists, colorectal surgeons even. And I think it's really important to be sensitive to the emotional toll that pain can take in these patients who have chronic pain. It really takes a lot out of you if you're in pain all the time. So we do have mental health professionals that we've incorporated into our practice. We have an endometriosis center that really has helped our patients to address perhaps the necessarily medical or surgical side of their care.
It's certainly the partnerships between both of your specialties and, as you said, mental health, behavioral health, it's just so important. And as you mentioned, it's not the same surgery maybe your mother had or your grandmother had, which is also important to understand. So Dr. Passes, explain what the most important thing is that you want people to understand. There's so much information, but what is really that key takeaway?
I think the most important thing is that patients understand that we hear them, we want to listen to them, we want to be a resource for them. We also want to be a resource for other providers in our community. We're really here to help everybody. We also recognize that there are disparities in healthcare that disproportionately and adversely affect all people, including people of color and those in our LGBTQIA community. So we are very open to all comers. We provide the best care for them and the best outcomes for them.
And Dr. Sachs, I'm sure your answer is similar, but what is that key takeaway from your perspective?
Sure. So, again, I think that there's actually a lot of misinformation out in the community, both about the conditions that we treat, but also the treatment options that are available. And so I sometimes hear the phrase like, I wasn't going to come to this appointment. I didn't really think there was much that can be done, or so-and-so had something done 20 years ago and it hasn't been helpful. And so again, just kind of reinforcing the advancement in our field and the wide variety of treatment options we have. Similar to Dr. Passes, we have many minimally invasive ways to do surgery and other procedures to really, make a significant improvement in patients' conditions and their quality of life. We really want to be a true partner in a woman's in her treatment plan and the care that she chooses. Again, this is a non-life-threatening conditions that I treat. And so we have a lot of room to kind of tailor the treatment to exactly what the woman herself wants and how she would like to proceed. Similarly, we really just try to provide care to a wide variety of patients. Anyone in the community that is seeking care, we are able to provide care for them. But it's an exciting time, I think, in general, in our field. Our field has really advanced significantly in the past 20 years. And it's a really exciting time to be able to just make such a significant impact for these women.
You mentioned the woman that comes in and says, I wasn't going to come. I don't know if I should be here. I don't know if you can help me. What is your message to those women who are saying, I'm not ready to go to a doctor, but I'll Google it, but I'll ask friends? Where can they go to maybe be a little bit more centered in their search?
Sure. So our national society has a really very user-friendly website that is geared specifically to patients with pelvic floor disorders, that has a wide variety of information, patient fact sheets on a lot of the conditions. But also, it's absolutely fine for a patient to come to our office and say, I'm not really sure if I want to do anything about this yet, but I want more information. I want to be educated. I want to see exactly what's going on. And I see patients like that every day. And maybe I'm able to diagnose their condition, educate them more about their condition, and maybe several years down the road, they're coming back in because they're finally tired of dealing with it, dealing with what's been going on, and they have been empowered to know kind of what options there are and what that course may look like.
Dr. Pasa, similar question for you. You said sometimes people go 10 years with endometriosis before coming to see you. How young can they start coming? And, other than talking to friends about, how heavy was your period? And do you have crazy cramps? I have crazy cramps. What should they really be trying to focus on to determine whether it's something they should come see you about?
Well, we're always here and available for patients to come and see us if they have concerns. I think that women who have really heavy bleeding, sometimes they're saturating through a pad an hour. I've had many patients do that. This is pain also that really impacts their day-to-day functioning. They have been missing school, they have been missing work, they're having accidents out in public also from the bleeding. This is just not a good quality of life for them. And I think anybody who's experiencing that can seek care. We see patients in their teenage years all the way through the menopausal period. So there's not really anybody that's, well, maybe babies, but we don't do babies, but anybody who's really having a cycle and problems with their cycle or problems with bleeding, we're happy to see.
Thank you both so much for this information today. Please take a minute. We'll start with Dr. Sachs to promote your practice and how people can get in touch with you.
Sure. So I believe you're going to push out that information specifically, but we are the Center for Urogynecology at Christiana Care. Our main office is on the Newark campus in the Medical Arts Pavilion attached to the main hospital. I also see patients on our at our Concord campus, which is just over the state line in Pennsylvania, off of 202, and so have availability to see patients at either location. Our practice does also see some patients at the Smyrna campus as well, for women that are downstate, to make that trip a little bit easier. And I guess you'll leave our practice information, but we have availability and are, here for seeing patients.
Fantastic. Dr. Passes.
We also see patients at the Newark location and also Medical Arts Pavilion 2 on the second floor, Suite 2103. My partner, Dr. Esther Hahn, sees patients at the Concord location on 202, similar to Dr. Sachs. And I also see patients at Smyrna Women's Health in Smyrna. We have availability for new patients all the time. So please contact us. And we also have availability via telemed and in-person visits.
Thank you both so much for being here today. And if you're watching and need more information, as they mentioned, those links will be in the comments below this Facebook Live for the practices and the doctors and any other information that they've mentioned today. And you can also continue to post questions after this live wraps, and we will get to those after and chat with you in the comments about that. Thanks so much for joining us and have a great afternoon.
Thank you so much.